Many people are logging on. We'll give it about another minute or so everybody has a chance to log on. Hello, everybody. As people are entering into our Zoom room, we're going to give it just another minute to let people log on, and then we will get started. It's wonderful to see so many cameras on and smiling faces. All right. Well, good afternoon, and welcome to the second meeting of the Community Review Board for the OHSU Legacy Transaction Review. I'm Rhonda Zaycox with Insight for Action, and I'll be facilitating these meetings. Next slide, please. Quick reminder about meeting logistics. This is a public meeting, so it is being recorded. After this meeting, the recording will be uploaded to the Oregon Health Authority's website. Closed captioning is available. A transcriber is also attending this meeting who will produce a written transcript after the meeting. I request that you state your name before asking a question or making a comment and speaking as clearly as possible to ensure an accurate transcription. For Community Review Board members, please raise your hand reaction in the Zoom feature, or you can physically raise your hand if you want to ask a question or make a comment. And please keep your microphone on mute until it's time to speak to reduce outside noise. Next slide, please. The Community Review Board members will discuss the transaction during these meetings. Members of the public can submit comments about the proposed transaction anytime using any of the options listed here. You can email hicmo.info@oha.org.gov. You can submit a comment via the public comment form on OHA's website or leave a voicemail at this number. All comments received will be posted on the OHSU Legacy transaction page. Next slide, please. As for the chat feature, only the host and co-host can see chat messages. In other words, if you place a message in the chat, no one will be able to see it except for the co-host and host. Community Review Board members, if you are experiencing any technical difficulties, for example, you are not able to unmute, send a chat message to Laura Neely. She would be one of the co-hosts that will be listed when you hit the chat button. Members of the public, if you have a comment or question for the Community Review Board, please use the options that we just reviewed. Send an email, voicemail, or online form instead of sending it via the chat. Next slide, please. Our primary objectives today are for the Community Review Board members to gain an understanding of the OHSU Legacy proposed transaction and develop an initial listing of concept questions for the upcoming public hearing. We will do a quick round of brief introductions and highlight the group agreements we made last week. OHA staff will share an overview about the proposed transaction. We'll begin discussing the impacts and questions that the Community Review Board members may have about the proposed transaction. And then we will brainstorm topics and questions for the public hearing. And then we'll close out and highlight the agenda for the next meeting. Next slide, please. Wow, from our first community review board meeting last week, it's clear we have a committed and engaged board. A heartfelt thanks for your service. Let's do a very quick round of introductions. It would be wonderful if you could turn on your camera when you say your name and where you live. To facilitate this, I'll call out each person's first name in alphabetical order for you then to give an introduction. So let's start with Wendy.
Hi, Wendy Martin, Portland, Oregon.
Thank you, Wendy. How about Teresa?
Hello, Teresa Goodell. I live in Aloha, Oregon.
Thank you, Teresa. Leslie?
Hi, Leslie Foran. I use she, her pronouns, and I'm from Portland.
Thank you. Latoria is unable to join us today due to a work engagement, so let's move to Joe.
Joe Schnabel, live in Portland, Oregon, and I'm off camera today because I'm traveling and my internet is very sketchy today. So I'll be on camera the rest of the time, I'm sure.
Thank you, Joe, and thank you for letting us know
Sure.
where you're at. Joanna?
Hi, Joanna Mott, Klamath Falls.
Thank you, Joanna. Jerry?
Hi, Jerry Dalmas, Westland, Oregon.
Thank you. Howard?
Hi, Howard Cohen, in Oregon City, Oregon.
Thank you very much. Next slide, please. As I mentioned, I'm Rhonda Zaycox with Insight for Action. I'm an independent consultant who will be facilitating all of the Community Review Board members' meetings. Zachary, you want to come off screen and say hello?
Hi, everyone. I'm Zachary Goldman with the Healthcare Market Oversight Team.
Thank you. Lauren?
Hi, I'm Lauren Neely, and I'm with the Healthcare Market Oversight Team as well.
Thank you. Next slide, please. As a reminder, these are the 8 group agreements that the Community Review Board agreed to during our first meeting. I'm going to leave it up for just a moment for folks to review the agreements. And thank you to everyone for doing our best to follow these agreements to ensure that we work well together. Next slide, please. During our first meeting last week, we agreed to hold a public hearing. Zachary now is going to remind us about the public hearing process. Next slide, please.
Thanks, Rhonda. So first and foremost, thank you to all the Community Review Board members for working with us to schedule the public hearing. So that it was there's a lift because there's a lot of us here. So we're looking at March 5th from 2 p.m. to 4 p.m. The proposed agenda of that public hearing is first for OHA staff to provide some high-level information about the proposed transaction, and then some brief presentation from the representatives from OHSU and Legacy. Then some testimony from representatives from the 2 entities, along with public comment. Now, it's important to note that OHA specifically will be asking the questions, and that's for legal reasons. OHA has the authority to swear people in for the representatives, so we'll be asking the questions kind of on behalf of the CRB. Let's go to the next slide, please. So OHA will be using multiple channels to get the word out. We'll be connected with newspapers and media outlets. We have newsletters, social media, and we'll be informing state and local officials, as well as coordinated care organization innovator agents. Community Review Board members, feel free to share a flyer, which we'll be posting with any colleagues, networks, neighbors, anyone you can think of who may be interested in attending the public hearing or someone who's interested in the proposed transaction. We will send a flyer to you all for you all to share. So we'll be doing that. We'll be doing that shortly. Let's go to the next slide. And just to kind of re-ground us into why we're here, we expect the Community Review Board to particularly inform the criteria that are highlighted here Now, obviously, there's a lot of criteria, but we're particularly interested in hearing on there's no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers or the public, as well as all the criteria on that right-hand side for B or C. And we talked about this last time, but just to reorient us to where we are.
Thank
I
you.
think that's it about yeah, go ahead, Rhonda. I think that's it about the public hearing.
Yeah, thank you, Zachary, for reminding us. I just wanted to pause and see if the Community Review Board members had any questions or clarifications around the public hearing at this moment in time. Joanna?
Yeah.
So I see you have a brief presentation by each of the entities, and then you say testimony from them. Is that going to be testimony in response to questions that we're raising, or what testimony are we talking about with that?
That's exactly right, Joanna. So testimony in regards to responses to questions that you all have.
Okay, thank you.
Thanks, Joanna, for that question. Okay, next slide, please. Okay, for this part of the agenda, which will be a good chunk of it up until our break at about one-ish or so, Zachary is going to provide an overview of the transaction. I'm requesting Community Review Board members to write down any questions that they have while Zachary is giving this presentation, because in order to ensure that we have enough time to cover all the content, we won't be taking questions during the presentation. After the presentation, around 1 o'clock-ish, we will have our 5-minute break. And then we'll open it up for the Community Review Board members to ask their questions. So that's why I'm just inviting you all to be jotting them down, because if you're anything like me, sometimes it's hard to remember. And if you want to, write down the slide number that was associated with your question. So that's why if we needed to kind of go back to that slide, we can do that. Okay, next slide, please. And I think I'm going to hand it off to Zachary.
Great. Thanks, Rhonda. So what I'd like to do here is do a kind of a high-level presentation on Oregon Health and Science University, OHSU, and then a high-level presentation on Legacy Health. Talk about the comparison of the two entities, and then go into some of the kind of high-level transaction terms. Notably, we will do a deeper dive about the transaction, the implications of the transaction in the next meeting. But right now, what we're trying to do is just ground everyone so we all have common knowledge on what these entities are and what are the high-level transaction terms. So if that sounds good, let's jump right in. Let's go to the next slide, please. So throughout the presentation, I'm going to be talking about the transaction, by which I mean the proposed merger between OHSU and Legacy. Now, technically, the transaction is what's legally called a member substitution, and it's more like an acquisition. But kind of colloquially, I've heard some folks talk about it as a merger or a deal, a business deal, or an acquisition. So that's what I mean when I say the word transaction. When I'm talking about the word entities, I'm specifically talking about Legacy Health and OHSU. There are other entities involved in this, related in this transaction, namely Legacy Health Foundation and Pacific Source. We're not going to talk a whole lot about those other two. We will mention it so that you have a global understanding of this transaction, but we will really focus on OHSU and Legacy Health today. By the way, Pacific Source is a health insurance carrier for folks who may not be familiar with that entity name. Okay, let's go to the next slide, please. And let's start at the top. So about Oregon Health and Science University. So OHSU was established in 1974 with a legislative mandate. It's an academic medical center. So that means it brings together clinical healthcare, hospitals, clinics, doctors' offices, as well as specialized services. There's an education component as well as a research component. Notably, OHSU is a governmental entity, so it's legislatively mandated, and its mission is legislatively mandated. And it's governed by a board of directors who are appointed by the governor. Let's go to the next slide, please. It's one of the largest employers in the Portland metro area. a couple years ago now, or a year and change ago, it served roughly 350,000 unique patients. It has approximately 180 outpatient clinics and locations, about 22,000 employees. In terms of total operating revenue, which is the monies that come in to OHSU, it's about $4.5 billion per year. And it serves patients statewide, including Southwest Washington. We're talking a lot about kind of the Portland impact here. It's the largest employer in Portland metro area, but it does serve patients statewide. And in fact, one of the factoids that OHSU presented in their notice is that most of their inpatient patients, so most of their hospitalized patients, come from outside the Portland metro area. So there are a lot of folks statewide across Oregon that access OHSU for services. Let's go to the next slide, please. So OHSU's mission is OHSU strives for excellence in education, research, and scholarship, clinical practice, and community service. Through its dynamic interdisciplinary environment, OHSU stimulates the spirit of inquiry, initiative, and cooperation among students, faculty, and staff. So you can tell that it's, OHSU is not just a hospital. It has that research component, has that education component. And its vision, our vision is to partner to make Oregon a national leader in health and science innovation for the purpose of improving the health and well-being of Oregonians and beyond. So that's OHSU's mission and vision, just to ground us a little bit. Let's go to the next slide and let's talk about the education component, which we just mentioned. So there are 55 degree programs across 5 different schools within OHSU. And these programs are for associate's degrees, baccalaureate, master's degrees, medical doctor, PhD, as well as graduate certificates. So there's a wide variety here. The latest data show just over 5,000 students and trainees. And that includes just under 1,000 graduate medical education residents, also known as GME, graduate medical education residents and fellows, as well as just over 4,000 individuals in OHSU degree or certificate programs. And there are 3,400 faculty members. Here's the enrollment you can see on the right-hand side. It's about 1,200 students in the School of Medicine. There's just over 1,000 for School of Nursing, over 300 in dentistry, and then 261 for School of Public Health. In a lot of these slides, we include a link at the bottom, and this is to, or a couple links, in fact, for this one, and this is to help CRB members if after this presentation, you're going through it, because these are all posted online, and you want to find more information or more context about a given factoid, feel free to visit that particular link, and that'll take you right to where these data are pulled from. Everything that we're looking at on this slide is for fiscal year 2023. So things may be slightly different for now, but as of right now, but these are the latest complete fiscal year data. Let's go to the next slide and let's talk about the research component of OHSU. So researchers were at OHSU were awarded almost $600 million in 2023. It's the largest research institution in Oregon. The research occurs in multiple places. So the schools of medicine, nursing, dentistry, public health, as well as the OHSU-OSU, which is Oregon State University. That's a partnership program, doctor of pharmacy program. And there are more than 30 specialized and multidisciplinary research institutes and centers. So not only is it kind of wide in that there's a lot of research happening in multiple locations, but it's really depth. There's a lot of depth there as well, because these research institutes and centers do a lot of work. And there's some more links at the bottom on that slide. Let's go to the next slide and talk about the foundation, the OHSU Foundation specifically. Now, there's a lot, there may be some questions about the Legacy Foundation because the notice talks about that a lot, but this is a different foundation. This is the OHSU Foundation. It's a 501c3. It's a charitable organization. It raises funds specifically for the OHSU Hospital, Dornbecker, which is the Children's Hospital, outpatient clinics that are run by OHSU, as well as for investments in the management of gifts responsive to the donor's wishes. And broadly, the foundation seeks to advance OHSU's mission. As of June of 2023, OHSU Foundation had more than $1.8 billion in assets, which makes it one of the largest public university foundations in the Northwest. And we have some more links there at the bottom. So that's the OHSU Foundation. Let's talk about clinical services. Let's go to the next slide, please. So there's a couple terms here that I want to orient everyone to. The first is primary care. Many of you are probably very familiar with this. This is routine care, preventive care, outpatient services. OHSU serves and provides primary care. They also have specialist care, which is sometimes also referred to as secondary care. So this is also kind of generally outpatient. The services listed, these are kind of the 4 service lines that OHSU talks about in some of their statement. And they talk about kind of the goal is to provide patients with a consistent experience and excellent care. That's kind of some of the quotes that we've pulled from the notice. We have a full list of all the different types of care in the notice, but we just wanted to highlight some of the concepts here. For tertiary care, and this may be a new term for some folks, but this is highly specialized care that requires maybe certain equipment, certain expertise. So this is not every hospital provides tertiary services. It's more specialized. OHSU also provides what's called quaternary services. This is an extension of tertiary care, but it's even more specialized. So think of treatment for a particularly rare disease, or a treatment that provides that requires a certain piece of equipment that is just very rare and not all hospitals have. So this is for kind of the most complex of services. You can think of an example of maybe tertiary service of being a complex heart surgery, maybe a quaternary service is an even more complex surgery, maybe involving an experimental treatment in association with research or a rare illness, as I mentioned before. Let's go to the next slide. And let's talk about the hospitals themselves. So the OHSU hospital, located on the Markham Hill campus. So they have the Dornbecker Children's Hospital as well as OHSU Main Hospital. Now the VA, there's a VA hospital on the Hill, but we're talking about just OHSU hospitals right now. It's in Portland, and there are 562 beds at the OHSU hospital. Now, there is notably two affiliated hospitals, OHSU Health Hillsborough Medical Center, as well as OHSU Adventist Health Portland. Now, OHSU and these affiliated hospitals, they operate under what's called a joint management agreement. So for the Hillsborough Medical Center, it was formerly called Tuality Healthcare. It's out in Hillsborough, and there are 134 beds in that hospital. The Adventist Health in Portland has 248 beds, so it's a little larger, but neither of them are as large as the OHSU Main Hospital on the Hill. Let me talk a minute about the joint management agreement. This joint management agreement is an agreement between the entities, these entities that we're looking at, that oversee and manage healthcare clinical enterprise strategy, as well as operations of these hospitals. So those are the hospitals that we're looking at. Let's go to the next slide and talk about some businesses or business interests that are associated with OHSU. So OHSU fully owns the following businesses. They have a medical billing service. There's an outpatient clinic management for OHSU outpatient clinics. There's a student-led health clinic. There's a hearing loss solution business. And OHSU is an insurer for their own self-insurance purposes, by which I mean the staff, the employees of OHSU are self-insured. OHSU pays for the claims that those employees receive when they go get healthcare. And so there's kind of an insurer business that's associated with OHSU. On the medical billing service companies, there's a University Andrology Lab, University Anesthesiology Associates, and Professional Medical Services. So there's a few different layers there. Let's see, on the on the hearing loss solution business that's called OHSU Sound Source. So Sound Source specializes in solutions for adults with hearing loss. And we can provide some, so there's some information about that in the notice there. So these are kind of the high level businesses that are under OHSU. Let's go to the next slide and let's talk a little bit more detail about these business interests. So for Tuality Health Plan Services, formerly known as Tuality Health Alliance, this is an integrated network of contracted and member health providers. So providers meaning physicians, physicians associates, et cetera. And this contracts with health plans and other payers. OHSU is the sole corporate member, so there's a strong link here. So that's Tuality Health Plan Services. There's also what's called OHSU Health IDS. IDS stands for Integrated Delivery System. So OHSU Health IDS LLC is an integrated healthcare delivery system management. Now this is in partnership with MODA, and OHSU owns 60% interest here. There's also and we talked about this a little bit before, OHSU-AH, which is Adventist Health. So this is a formal clinical affiliation between OHSU and Adventist Health, and OHSU has 50% equity in this entity. Then there's also OHSU Project Co. Now this is stop-loss insurance for provider networks. Stop-loss insurance is a business in which because they're self-insured, if a given employee has a significantly costly medical experience, maybe they're hospitalized for a very long time, stop-loss insurance is insurance on insurance, which is to say, if someone incurs, let's say, a $5 million hospital stay, it's a very lengthy intensive care unit stay or something else that's incredibly costly, this insurance kicks in and kind of smooths, if multiple employers do that, it smooths out that utilization or smooths out those costs. So OHSU has 50% equity, or excuse me, 34.8% equity in OHSU Project Co. And next is Life Flight Network. This is air and ground medical transport. Maybe you've seen the helicopters flying around, but this is an ambulance in the sky, Life Flight Network. And then there's Pacific Northwest Renal Services. This is a dialysis service for folks experiencing renal diseases. There's 5% equity in that entity from OHSU. And then there's an Oregon Fiber Partnership, which is a nonprofit organization, and OHSU is a member of that. I know that's a lot of detail that I just threw at you. Fear not, all this information is on the slides if you want to refer to it later. And all this information is taken from stuff that's already posted online. So if you ever want a refresher, you can always go back. Let's keep going here. Let's go to the next slide and let's look at geographic region. OHSU has a lot of partnerships with a lot of other entities, clinics, hospitals throughout the state. And the nature of those partnerships are varied. Some are specific to cancer care. Some are specific to primary care or family medicine. Others are specific to behavioral health. Some pertain to complex healthcare needs, and some focus on pediatrics. So it's a lot of different specialties and a lot of different types of services. You can get a sense on the map here that there's a lot going on across the state. So for example, Oregon State Hospital, there's a relationship that OHSU has for folks needing behavioral health services. For cancer care, there are partnerships with Columbia Memorial Hospital, Bay Area Hospital, Adventist Health in the Gorge, as well as St. Charles Health System in Bend. So a lot of different partnerships, a lot of different types of services. Let's go to the next slide. And I think that wraps up OHSU, at least at a high level. Again, we're going to go into more detail about the transaction and implications of the transaction at the next meeting. But we just wanted to ground you all on, what is OHSU? What kinds of services does it provide? To whom does it provide? But let's shift gears. Let's look at Legacy Health. Let's go to the next slide. So Legacy is a nonprofit health system in Portland and Vancouver areas, and they also serve the Mid-Willamette Valley. There are more than 550,000 patients served, 14,000 employees, so slightly smaller number of employees compared to OHSU, 70 outpatient clinics, So fewer outpatient clinics, but more hospitals. There's 6 hospitals for Legacy, and that's about 1,600 licensed inpatient beds, about 41,000 inpatient discharges, and I believe this is for 2023, and just over $2.5 billion in total operating revenues for Legacy Health. Let's go to the next slide. So in terms of governance, unlike OHSU, which is a board of directors appointed by the governor, Legacy's board of directors is different. So there are 4 Legacy Health physician representatives, and these are recommended by any member of the active medical staff, and they are elected by the board. There are also 9 community members. These are elected at large by the board. There's 1 representative and active member of the Lutheran Synod of Oregon, and there's 1 representative and active member of the Episcopal Diocese of Oregon. And then there's the Bishop of Oregon Synod of the Evangelical Lutheran Church in America, or the bishop's designee, serves as ex officio on the board. And similarly, the Bishop of the Episcopal Diocese of Oregon, or a designee, also serves as ex officio. And then the president of Legacy serves as an ex officio capacity. So that's the governance, different. They both have boards of directors, obviously, but different composition and different way of getting onto the board. Let's go to the next slide and talk about the mission of Legacy, which is our mission is good health for our people, our patients, our communities, and our world. Above all, we will do the right thing. And we linked, in case you're interested to read more, Legacy has a website about who we are, and there's some good information there. Let's talk about the Legacy hospitals. Let's go to the next slide. So there's Legacy Meridian Park Hospital and Medical Center. This is in Tualatin, 150 beds. There's Legacy Mount Hood Medical Center. This is in Gresham, 115 beds. There's Legacy Silverton, and that's in Silverton, Oregon, 48 beds. So that's a much smaller facility. That's a level 4 trauma, which is different than the level 1 trauma of some of these other hospitals we're going to talk about, as well as OHSU is a level 1. So Legacy Silverton is a much smaller facility. They do have a family birth center, and they provide CT scanning as well as nuclear medicine. Legacy Emmanuel is the large hospital, a level 1 trauma center. They have a NICU, level 4 NICU, which means the most intensive, most complex cases can be treated in that NICU. They have 447 beds. It's located in North Portland. That's Legacy Emmanuel. Legacy Unity Behavioral Health. Now this one's interesting, and this one's a little different. This is a behavioral health hospital. It's in Northeast Portland, just over 100 beds. It's owned by multiple hospitals in Oregon. So this one's a little different than all the others. That one's really a partnership facility. Then there's Legacy Good Sam, or Legacy Good Samaritan Hospital. That's in Northwest Portland, 539 beds. And then there's Legacy Salmon Creek Medical Center, and this one's in Washington. This is in Vancouver, 220 beds. They offer inpatient and outpatient services, and they have the Legacy Cancer Institute right there. One other quick note about the Legacy Unity Behavioral Health. I mentioned it's a partnership, but it's specifically a partnership between Legacy, Adventist Health, Kaiser Permanente, and OHSU. So those 4 entities all partner on the Legacy Unity Behavioral Health. That's the only one in which the hospitals that we're looking at, they're all Legacy. These are all Legacy hospitals, but Legacy Unity is one in which there's already a full partnership there. So those are the hospitals. Let's look more about the hospitals and the kinds of services they provide. Let's go to the next slide. So right at the top, there we go. Thank you. Right at the top. So Emmanuel, which is the big one. This is not an exhaustive list of services. We have neurosciences, cardiovascular services, children's pediatric care, obstetrics and gynecology, behavioral health, and oncology. This isn't every service that these hospitals provide, but it's a good sense of kind of what differentiates some of these hospitals. So Emmanuel Hospital, which includes Randall Children's Hospital, provides all 6 of these, excuse me. Whereas Good Sam, Meridian Park, Mount Hood, and Salmon Creek Hospital provide all of them except the children's pediatric care and behavioral health. And then at the bottom, Unity kind of shows that's just a behavioral health hospital. And then Silverton would refer out for a lot of these services, with the exception of a family birthing center, OBGYN. So you can get the sense of how these hospitals differ from each other. How comprehensive are they versus how focused are they? So those are the specialty services available at the legacy hospitals. Let's go to the next slide and talk a little bit about the foundation. This is Legacy Foundation, different than OHSU's foundation. So Legacy's foundation, and there's multiple Legacy foundations actually. So many of Legacy's hospitals have their own foundation. So there's the Emmanuel Foundation, for example. But there's also a general Legacy Foundation that's not attached to a specific hospital. So charitable donations to the foundation support legacy programs and services and fund community-based organizations that support health and well-being. In 2022, the foundation had $44 million in assets, and the foundation is a nonprofit entity governed by a board of trustees. So some examples of Legacy Foundation investments include providing emergency medications to patients, durable medical equipment, transitional housing, maybe other health-related supplies to uninsured folks or underinsured folks. They've done some work on providing emergency food support to families experiencing food insecurity, supporting injury prevention programs for the community, including child passenger safety, bicycle helmets, elderly fall prevention, burn injury prevention, things like that. And the foundation also purchases, at times, medical equipment for the legacy hospitals. So that's the Legacy Foundation or foundations. Let's talk about the business interests of Legacy. Let's go on to the next slide. And y'all are doing great. Bear with me. I know this is a lot of me just talking at you, so I appreciate your patience here. So in terms of the business interests of Legacy, there are a few that I want to highlight. There's the Legacy USP Surgery Centers. This is a partnership to operate what are called ASCs, Ambulatory Surgical Centers. And Legacy has a slight majority share, 50.1% interest in that entity. Then there's what's called Northwest Hospital Partnership. This is an investment entity. So the hospital takes some of its money and invests it so that that money can grow. And there's 50% interest in that entity. I want to highlight Pacific Source, which I mentioned before is a health insurance company. Pacific Source offers Medicare Advantage as well as commercial products, and is associated with some of the coordinated care organizations in Oregon, which operate the Oregon Health Plan, OHP, which is the Medicaid program. So Legacy has 50% share in Pacific Source, in the insurance company itself. And then there's, I also want to highlight the Life Flight Network, which OHSU also has 25% share. So this is the emergency medical transport, helicopters and on the ground. So Legacy has 25% equity in Life Flight Network. There are others here, but I don't think I need to go through each one, but these are all here. And then again, just like we did for OHSU, the document that lists all the Legacy business interests is already posted online. Let's go to the next slide here, and bear with me for just a handful of more slides, because what I want to do is talk about the combination of, I kind of want to do some comparing and contrasting of OHSU and Legacy Health, and then we're going to do some high-level transaction terms, and then I'm finally going to stop talking, and then welcome your questions and discussions, and we can talk. So let's go to the next slide. Now, this proposed transaction has been in the news. I'm sure you all are well aware of it. Perhaps that's why you volunteered to be on the Community Review Board. But here are some of the titles that we've seen in the news, and there have been many more. So a lot of outlets, media outlets, have been covering this particular proposed transaction. Let's go to the next slide and talk a little bit about a timeline. So back in August 2023, Legacy and OHSU signed a letter of intent. Shortly thereafter, in May 2024, the entities signed a definitive agreement which described the terms of the transaction. And then in October, so a few months later, OHSU accepted the complete what's called Notice of Material Change transaction. This was the kind of official document that notifies the state that there's a proposed transaction being contemplated, and that's what sets off the preliminary review that OHA and the Healthcare Market Oversight Program conducts. So that was back in October 2024. The following month, 30 days later, in November 2024, OHSU began the comprehensive review of the transaction. So it closed the preliminary review, determined that a comprehensive review was warranted. So this is kind of how we've gotten to where we are today. Let's go to the next slide. And just look at the current status of these two entities. So OHSU on the left, Legacy Health on the right, both are level 1 trauma centers. They're the only two level 1 trauma centers in the state of Oregon. They both have NICU, which is Neonatal Intensive Care Unit. Sorry, I didn't specify that acronym earlier. NICU stands for Neonatal Intensive Care Unit. They both have the highest level of care, so they can both treat the most complex cases for neonates, for newborn babies. They both have a children's hospital, OHSU has Dornbecker, Legacy Health has Randall. They both have 25% ownership in LifeFlight. The other owners of LifeFlight are St. Alphonsus and Providence, so they all own 25% each. OHSU has 576 beds, which includes Dornbecker. The Hillsborough Medical Center has 134 beds, and Portland Adventist has 248. Remember, we talked earlier about that management service agreement. So they're different but related entities with OHSU, and over 21,000 employees. On the Legacy Health side, over 1,600 beds across all their hospitals. And 14,000 employees. Note that both OHSU and Legacy have facilities in and serve residents of Washington State. So that's just kind of a little asterisk, just important to note. We're focusing on the Oregon footprint and the Oregon impact, but there are some facilities and services rendered to Washington residents in Washington. Okay, let's go to the next slide, and let me kind of wrap up with just a handful of slides, well, maybe a little more than a handful, apologies, to talk about the transaction terms. And apologies in advance as well, these slides are text heavy. The transaction details are really important, so we tried to summarize them as best we could, and sometimes it's just more conducive to put the whole sentence on there, just so it's really, really clear. Okay, so let's jump into the transaction details. So OHSU is proposing to buy Legacy, after which Legacy would be fully integrated into OHSU. OHSU states that the transaction, it won't change the level of services and will allow OHSU to expand access to services. In terms of the dollars, the proposed transaction would mean OHSU assumes the $3 billion of Legacy's assets and $1.4 billion in Legacy's liabilities. And OHSU would assume $1 billion in debt to finance capital expenditures, which means OHSU would take on new debt to expand investments, sorry, not to expand, to invest in capital expenditures, such as investments in facilities, IT, information technology, and expand or create new programs and services across the public university health system. So at a really high level nutshell, that's what this transaction is talking about. Let's go to the next slide. There are a number of goals that the entities themselves specify for this transaction. So one is to create combined organization to achieve its mission. Secondly, coordinate and deliver high quality, cost-effective care. Thirdly, build upon existing academic community-based facilities. Use the best practice to enhance quality, access, efficiency of care. Maintain and improve healthcare access to the underserved. Expand access to clinical trials and other research. Let's go to the next slide. And continuing, expand relationships with physicians using employment to provide fully integrated services. Economies of scale is another goal. Strengthen financial health. Enhance academic footprint, which would mean expanding training opportunities. And lastly, accelerate ability to transition to value-based care. Value-based care is a term that is often used kind of in comparison to a lot of healthcare is paid for on what's called a fee for service. So you come in, you get this service, and a payer or health insurance company is going to pay X number of dollars for that service. Value-based care is oftentimes different, and it's either paying for quality outcomes or quality improvement, or sometimes paying for someone's health regardless of how many services are rendered. Just you have a certain number of people attributed to you. Here's a certain specific amount of money to provide care to those folks. Doesn't matter how many services are rendered or not. So it's supposed to incentivize outcomes over quantity of care. Let's go to the next slide and talk about what the structure would be. This slide is hard to read. Apologies for that. But at a high level, OHSU would have continue to have three components: OHSU Health, which it does now; higher education, obviously, which it does now; and research, which it does now. But the added piece would be sort of inserting Legacy under OHSU Health. So there'd be a Portland division, there'd be a regional and ambulatory division, and then there'd be the medical groups, which is the providers and the entities that kind of aggregate those providers. Let's go to the next, and these are all available on our website. Let's go to the next slide. Let me talk a minute about the foundation, the Legacy Foundation, and Pacific Source, because it's related, but it's different. So just to ground us here, the Healthcare Market Oversight Program is reviewing the transaction between OHSU and Legacy Health. Now, the Healthcare Market Oversight Program is also reviewing this particular transaction that we're looking at now, which is related to the OHSU Legacy transaction, but it is its own separate transaction. So what is that transaction? So this would mean the transfer of Legacy's net cash to a foundation, and roughly $350 million, but that's subject to change. It would also transfer Legacy's current 50% ownership of Pacific Source to the new foundation. And Legacy Foundation would spin off and become its own entity that would focus on health equity grant making. And the entities state that this would be the largest philanthropic organization focused primarily on improving health equity and addressing social determinants of health in Oregon. We're not asking you all to weigh in on this transaction, the Legacy Foundation Pacific Source transaction, but it's important for you just to know that it exists, because it is related in a way, because it's kind of it's all part of the same package. But the transaction that we are particularly looking at is the OHSU Legacy Health transaction. Let's go to the next slide, and bear with me, just a handful more slides. So some of the stated reasons for the transactions, they're at least twofold. One is Legacy's financial situation. So after removing one-time non-reoccurring items, Legacy lost $96 million in the last fiscal year, and that ended in March of last year. We're still in that following fiscal year. And the proposed transaction would result in a capital infusion for Legacy. The entities also state that it would solve a shortage of acute care beds and primary care providers. So they state that Legacy has capacity that's not staffed or utilized. They state that 11% of Legacy's operating capacity is not utilized, and that the proposed transaction would increase OHSU's capacity to increase access to care and educational training opportunities. Let's go to the next slide and talk about, well, what happens after the transaction. So it would look like one integrated public health university system. So this would be a publicly appointed OHSU board of directors will be the sole fiduciary board for the entire system. It would create the Health Equity Foundation that we just talked about, part of that Pacific Source Legacy Foundation component. There'd be $1 billion capital investment for both OHSU and Legacy hospitals, because that investment is for the enterprise-wide. And the entities state that there are no plans to reduce or close the number or types of service locations. let's go to the next slide and talk about workforce, and then this is going to be my last point, and then we can stop here for a second. So in terms of post-transaction plans for the workforce, the entities state that there'd be no layoffs for at least the first 6 months after closing the transaction, after the transaction is finalized. So they state that legacy health employees would retain their benefits, retirement, and seniority at closing, and they become public employees of the state of Oregon. OHSU would also evaluate the feasibility and appropriateness of moving to integrated system-wide employment policies over time. And they state, there's a quote, "In combining, the system will eliminate obvious duplication and redundancy, which may require workforce reductions in some areas, as is appropriate for any transaction of this size and scope." So that's taken from their notice. I think that's all I want to say about that. Oh, there's one other point. The OHSU board, there's some language in the notice that the OHSU board may consider adding opportunities for employee participation in the state of Oregon public employee retirement system benefits. So that's the PERS benefits. Let's go to the next slide, and this is my final slide here on the workforce. So OHSU has made additional commitments with bargaining unit members for AFSCME, ONA, OFNHP. Don't worry, I'm gonna spell these out. SEIU and PNWHMA. So AFSCME is the American Federation of State, County, and Municipal Employees. That's AFSCME. The ONA is the Oregon Nurses Association. OFNHP is sorry, I had it right here and now it's gone. Is that the apologies? I'm gonna pull that one out. I had my note here, but then it just went away. SEIU is Service Employees International Union, and PNWHMA is Pacific Northwest Hospital Medicine Association. So that last one is hospitalists specifically. OFNHP, oh wait, here it is. Sorry, my notes got all jumbled up, is the Oregon Federation of Nurses and Health Professionals. So OHSU has made additional commitments to these labor organizations for guaranteed employment for at least 12 months post-closing. If layoffs occur between 12 and 24 months, so a year to 2 years after closing, it would result in 6 months severance, human resources support, and retraining opportunities. They also commit that there be no decreases in current wage rates, premium differential rates, or benefit contribution amounts or levels, and there'd be pay equity. So that's just a little tidbits about the workforce commitments and statements that the entities have made thus far. That was a lot. So I just covered a lot of material. Rhonda, let me pass it back to you and see how you want to handle this going forward. Do you want to jump to a break, or do you want to jump into?
Yeah, I think, well, first of all, Zachary, thank you for that very informative information. Obviously, this is a huge transaction. And so thank you for really breaking down, what does OHSU look like? I see some hands clapping there as well. So you have some fans in the audience to really succinctly describe, what does OHSU look like? What is Legacy? Really comparing what do the two look like when you put them side by side? And then really just giving an overview of those transaction terms. So I just want to reiterate what Zachary said at the beginning. This session today was really just to paint a picture of what these entities look like, what is the proposed transaction. Next week, as Zachary said, we'll dig more into what might be the impacts, correct, Zachary, of this proposed transaction.
Yeah.
So I just thank everybody for listening. Hopefully, Community Review Board members had an opportunity to write some questions down that they would like to ask Zachary after the 5-minute break. So I'm suggesting that we take a break now. Let's be back at 1 o'clock, and we'll be ready to start answering your questions. So see you at 1. Those Community Review Board members that I see turning on your cameras, I appreciate it. I'd appreciate it if all the Community Review Board members who are here to turn on your camera or put on your thumbs up so I can just make sure that we've had a chance. Thanks, Joe. All right, I see Teresa. See Leslie, great. See Wendy. All right, see Jerry, awesome. Wonderful. Now, let's, if we can move to the next slide, please. Now, let's jump into your questions. Next slide, please. Now that we've had the opportunity to listen to Zachary's excellent overview of the transaction, and I know many of the Community Review Board members have read numerous documents on OHA's website, including the transaction notice, the preliminary reports, and maybe even some public comments. I now invite Community Review Board members to ask questions about the transaction. And Teresa, I see your hand and I will get right to you. But I want to just go over the process first. And that is, we have about 25 minutes right now for us just to focus on clarifying questions. What questions do you have about the transaction? What do you not know or would need to know in order to make a recommendation? So that's what we're going to focus on now. After around this 25 minutes of people being able to get their questions asked, we will then move into more of a brainstorming session where we'll start articulating what are some general questions or concepts that we want to ask the entities at the public hearing. So if you share some, questions for the public hearing during this time, that's fine. I'll keep note of them. But I just want to let you know we're going to have another brainstorming session after this, really to really clarify what are the questions we have for the entities during the public hearing. So this is the process I'm going to propose because we have a limited amount of time, about 25 minutes. This is a big transaction, as we've seen, and I want to make sure that everybody has an opportunity to ask questions. So this is the process I'm inviting us to participate in. In round one, everyone has an opportunity to ask up to 3 questions. Please use your hand reaction button. And I will call you in order as I see the hand raised. Those who didn't raise a hand, I will just at the end call it your name just to offer an opportunity for you to ask a question. And of course, if you don't have a question because all your questions have already been answered, that's fine too. Just want to make sure everybody has an opportunity to do that. Then in round 2, after everybody, all the Community Review Board members have had an opportunity to ask questions, then we'll just open it up to additional questions from Community Review Board members. Again, I'm reminding the public that you can recall from that earlier slide that there's many venues for you to provide comments, including on the chat. I see there is a reminder of those processes. Okay. Are there any questions about the process before we begin? I see some hands raised, but I know those hands were for questions. Okay, I'm going to jump in and I see Joe, you're at the top of my screen. So please ask your questions.
Okay, thank you. And lucky me. The audio cut out just a little bit, but I think I got most of what Zachary said, and I appreciated all of that because it's good to hear it after you've read it, and I'll probably need to hear it and read it many more times to totally know what I'm seeing. But I had probably maybe 3 questions. I had a lot of questions, but the 3 that are most relevant, I think, are, let me find them here. Legacy in the last fiscal year was 95 million in revenue. Now, hospitals I know go through negative revenue years and hopefully fewer of those than positive revenue years, right? I wonder how this one compares with negative revenue years that Legacy has had in the past. And I think, did they determine that this was not a recoverable situation? And I assume they must have, but I want to know kind of what the difference was this time in terms of magnitude of negative revenue, if they've ever had a negative revenue year, which I'm thinking they must have. That's the one question. Another one is that they appear to have made a guaranteed employment commitment different for the representatives, or at least the employees. Are there other unions that weren't part of this deal? And for those employees that didn't get this guarantee. I'm just kind of wondering why they couldn't have done this for everybody, would be my question for them. And then the other kind of glaring thing was that Legacy went into this looking for a strategic partner, and then they got acquired, or their proposed changed it to be a proposal for acquisition. I want to know kind of what their thoughts were going into that big change.
Thank you, Joe, for articulating those three questions. And Zachary, I believe you're going to be responding. I also want to mention that I'm sure Zachary will say he'll do the best that he can to answer those questions, but there may be some questions that he will have to gather additional information and come back to answer those questions next week. But go ahead, Zachary.
Yeah, that's exactly right. So thanks, Joe, for those good questions. So regarding the first question about negative revenues, I will note that Legacy included financial statements as part of their notification to us, and those are posted. Your specific question was, have they ever been in the negative? I'd have to go back and see their particular history of the posted financial statements. But the 2018 to 19 is the earliest that they submitted as part of this transaction. So they submitted 2018 to 19, 19 to 20, 20 to 21, 21 to 22, and then 22 to 23. And we can add a link to the Oregon Health Authority Hospital Reporting Program, which provides robust financial public reports, and they have multiple dashboards for every hospital. So we can be sure to send that around as well. So you can look not just at Legacy's own history, but you can compare it to other hospitals, OHSU and any other hospital in the state. So we'll be sure to get you that information so you have it at your fingertips. Your second question about were there other unions involved in the kind of discussion and commitments. As far as we can tell, the OHSU unions are covered, which is to say the commitment includes the unions that at least we have heard from, and that's on the OHSU side. I believe the answer is yes, they've included the unions that they work with in their commitment. And then the third question was about kind of how is Legacy feeling about the acquisition. I don't know how I can answer that. I mean, in the materials, these materials are jointly submitted by OHSU and Legacy. They both agreed to the terms here. I think that's all I can say. I want to be careful not to opine on assume anything about the parties that I don't know to be true based on the information that they provided.
So this is Joe Schnabel again. The question would, maybe I didn't articulate quite as well as I could have, is not mainly how they were feeling, but what kind of went into that pivot from seeking a strategic partner to kind of accepting an acquisition. And whether I guess they must have felt that was their only choice, but I'd like to know a little bit more about the kind of the background of, that's a huge change to me.
Yeah, that may be a ripe question if you all agree for a public hearing type of question to get more information about that. But I defer to you all on that.
And thank you, Joe, for re-clarifying that question. And I'm starring questions that may be, applicable to ask at the public hearing. So when we go to that brainstorming session, we will link back to that. Thanks, Zachary, for answering those questions. And I heard that you will kind of do a little bit more work on Joe's first question in terms of being able to synthesize what their potential loss has been previous years. Thank you. I'm going to move on now to Joanna. Thank you for asking your three questions. Come off mute.
Yes. So one of my questions is really kind of piggybacks on this Legacy. Why did they go this direction? And so I think more clarification, as he was asking about, for their longer term financial situation. and if this doesn't go through, like, what is their plan B? Like, is this a last resort? As you say, they accepted an acquisition, which you would think would be not a first choice. So I think a little bit more information about the situation with Legacy and I don't want to say how dire it is, but what happens if this doesn't go through and why did they accept this, which I think coming from the public hearing would be useful. The second thing was it's been mentioned that there are facilities in Washington State. Does Washington State have any kind of oversight role in this separately? I know we're not dealing with them, but is there something going on in Washington State, or they're just like, nah, this is Oregon, and it's up to OHA to make this decision? And the last one I had was it was mentioned in the transaction, the notice of transaction, I think it was. There was a statement about the Pacific Source, the Legacy Pacific Source transaction, and that if that didn't go through, this wasn't going to go through either. OHSU made that statement. Well, I don't know. It was made in that. And I guess that means we need to have at least some idea of what is happening with that. And I guess I'd like a little more clarity about why is it that it's a both or none.
Yeah. Rhonda, can I jump in?
Please.
So yeah, great questions, Joanna. So for your first question, yeah, as I said to Joe, yeah, that may be a ripe area of inquiry for the public hearing if you all deem it so, to get some more background there. The second question about Washington State. So Washington State does not have a parallel program like healthcare market oversight program. So they do not have a similar review process like we do here in Oregon and we're undertaking right now. And then lastly, you are correct. In the notice, the entities say that both transactions must be kind of approved in order for the whole transaction to go forward. So both the OHSU-Legacy proposed transaction must be approved or approved with conditions, as well as the Legacy Foundation and Pacific Source transaction has to go through. So although, and I mentioned this before, although they are separate transactions, but they are related in that the entities view them as both being necessary to accomplish the overall goals that they're trying to do.
Okay, thank you, Zachary, for answering those questions. I see Wendy next. Please ask your questions.
Yes, hi. A little different on the questions. So in the material, Legacy cited that they were not utilizing their full capacity. I'm wondering what reasons they gave for that and how this would overcome those challenges. And then also, they also noted that it would increase access to primary care. I'm curious how.
Wendy, are those your two questions?
Yep.
Thank you so much for asking those.
Yeah, for the I can jump in. This is Zachary. For the first one, I think both of these actually are probably ripe for additional inquiry into the public hearing if you all wanted to go down that road. There's nothing that I can recall off the top of my head. Now there are a lot of materials, and I haven't memorized all of them, but there's nothing at the top of my head that specifically states the reason as to why capacity is currently underutilized. And then the increase in primary care. I know there were some responses to a request for information that is public that we posted, and the entities talked a little bit about primary care, I believe, but that might be a good area to reread if you haven't yet done so. And that's the request for information responses that they've sent.
Thank you, Zachary. And again, I'm starring those questions that have come up that might be good ones for us to consider for the public hearing. All right. Wendy, are we good on that? Okay, thank you. Howard, I think you're next in line. Thanks for asking your 3 questions.
Great. I have to decide what they are, I guess now. I do appreciate Joanna's questions around Washington State and Southwest Washington, which I agree with. I think that's important. That is part of the transaction. And I would just point out, I know OHSU provides services at Southwest Washington at Peace Health, perinatal services for sure, and maybe others. And so this is going to have an impact in Washington. An example would be there are 2 NICUs in Southwest Washington, one that's managed by legacy providers, or rather independent group providers, Northwest Newborn, my old group, and one provided by OHSU providers. And this acquisition may have some impact on that. So I think Southwest Washington's important. And also what she stated, I agree with about this Legacy Foundation Pacific Source part of this whole deal. And it seems like we should have a lot of information about that since they, as you said, they're being brought forward as needing to both happen or neither will happen. So sorry for that, but my questions. Well, one is around the issue about personnel. I think on the legacy side, I'm not sure about unions for the nursing staff on the legacy side, whether there are some union employees and some not. At least when I worked there, I don't think there were. So I would just ask, I re-emphasize that important issue. There were important public comments around the cost going forward afterwards and what kind of assurances there would be and accountability there would be around maintaining the cost predictions that they're making, and perhaps also needing more specifics around what those projections would be around both how that might impact payers as well as individuals and or the state of Oregon, which has some responsibility, of course, for the OHSU. I think that might be 3. As a small question, does Randall Children's Hospital have its own license, or is it just one license with Emmanuel?
That is a good question, Howard. Let me find that answer out and get back to you. I don't know off the top of my head. I know it's co-located, but whether it has its own license is a good question. We can find that out.
Okay. I think that's enough questions from me.
Yeah, so thank you, Howard, for those questions. Zachary, you willing to start answering those?
Well, so specifically about the license question, Howard, you raised other really important questions that I think you probably all want to discuss, maybe raising in the public hearing or raising for the public hearing and brainstorming. Also, Howard, you mentioned, and other folks have mentioned too, just wanting to understand more information about the Legacy Foundation and the Pacific Source transaction. We can send you all a link to all the publicly posted information about that transaction. So that might be helpful as well to fill out some of that context. So we'll be sure to send that to you all so you have it at your fingertips.
Howard, we good for right now? Okay, thank you. Teresa, thank you for asking your questions.
Yeah, thanks. I am interested in the Life Flight network. I see St. Alphonsus, as Zachary mentioned, owns 25% share. They're out in rural Eastern Oregon, as my understanding is. And so that would leave OHSU in the metro area with a 50% share in Life Flight. And I'm concerned about the effects of that upon pricing. Will Life Flight prices go up dramatically because OHSU is the major player with 50% share in the Portland metro area. And of course, that would also affect people all around the state. My second question is, given the financial and the instability in upper management that has recently happened at OHSU, and what appears to be difficult financial times there, I'm concerned about their ability to service an additional $1 billion in debt in order to take over Legacy. My last question is, how are they going to recruit more healthcare providers, which everything kind of seems to hinge on that, the capacity to increase access and improve equity probably hinges heavily on the capacity to recruit more providers at a time when OHSU already has a shortage of primary care providers. And that might be the limiting factor for Legacy as well, but as we've mentioned, we don't really know. Thanks.
Teresa, thank you so much for those questions. Zachary, are there some background information that you can provide for any of those three questions?
Yeah, those are great questions, Teresa. I will point to in one document that we have posted in the response to our request for information, the entities did talk a little bit about primary care and reducing average wait times to access a primary care provider. So that there's some information there about that specific question about how they will expand. Regarding the others, I don't have answers for you. So those might be good questions for you all to brainstorm.
Great. And Zachary, for that document that you mentioned that talks about potentially how access to primary care and reducing wait times may happen, is that something that you can specifically like pull out to or identify the document to look at for that?
Can do. Yep. Can do.
Okay, great. So this will be in the follow-up. Thank you.
Exactly.
Okay.
Yep.
Great. I mean, community review board members, as you can see, this Oregon Health Authority staff is really dedicated to making sure that you have information and try to get your hands on information when there is so much out there on the website. So we just so appreciate your willingness to kind of narrow it down for people to find the information that's important for them. Thank you.
Yep.
Okay, next I see Leslie, please.
Thanks, Rhonda, and thanks to the committee for these great questions. I had very similar ones. Mine are a little bit different and kind of building off of what Teresa was saying around leadership changes up at OHSU. I had the opportunity to read all of the public comments, and that is something that the public is concerned about. Is now I don't think anyone from original leadership from when this conversation started at OHSU to where we are today. And so wanting to get clarification on the new leadership and how they feel about this, how they're approaching this. And in addition to that, I've been reading the headlines around the executive orders from the Trump administration about NIH funding and how that will impact OHSU. And so wanted to just see what is the state of affairs and just get an update on leadership and today's financial standing. I'm also curious about, there was a public comment, and I have a site I can give to the staff or whomever. Someone wrote a comment to the community review board and mentions that there's redacted documents that we don't have access to or information. So I want to verify that we have the full information and the necessary tools to make a recommendation. And then my last question is around, it's tough, I have four, but I'll pick one. Around quality metrics not currently being achieved by OHSU and how they will guarantee they can do the work with the merger and what is their compliance monitoring proposal.
Yeah, those are great questions, Leslie. Most of those, in fact, all of those are probably really great to brainstorm as a group to see if you want to raise those for the public hearing. A couple immediate responses. So you mentioned public comment, which is great. I'm so glad you read the public comment, and I did want to plug and just remind all community review board members, we continue to receive public comment every day. So it's good to keep reading even the refreshed public comments. Even if you read it last week, we likely received some more. We received some this morning. So it's good to read all public comments before the meeting and just continually refreshing them. So that's really good. You mentioned, let's see, some of the questions I can't answer because I don't have the answers to regarding leadership, things like that. Let's see, I'm going through my notes. Oh, you mentioned redactions. So let me chat about that for a quick minute. So by statute, and I'm actually pulling up the statute. Here we go. Yeah, so there's some important clauses in the statute, which is our state law that created the healthcare market oversight program. It says the authority shall maintain the confidentiality of all confidential information and documents that are not publicly available that are obtained in relation to a material change transaction and may not disclose the information or documents to any person, including a member of the review board, without the consent of the person who provided the information or document. So that'd be the entities themselves. And then there's some additional information about kind of confidentiality there. So we are beholden to state law. So we have to comply with those confidentiality requirements. That said, if there's a question that you all have and would like the entities to answer it, the public hearing would be a good opportunity to ask those questions. And then you asked questions about kind of federal changes and NIH funding. I don't have the answers to those. So if that's important, if that's an important kind of data point in your ultimate recommendation, that again would be a good a ripe area for brainstorming.
And I just quickly ask, who decides on redactions, what's allowed, who's looking at them to make sure they're correct?
Oh, that's a great question, Howard. Thank you. So we do, in conjunction with the Department of Justice, to verify that a sentence, a data point, any statement that they're making is in fact confidential and complies with the statutes related to confidentiality and trade secret. And if something is, if they say something that is they're claiming is confidential that is in fact not confidential, we tell the entities that's not confidential. You have to unredact that.
Great. Thank you, Howard, for that clarifying question, and Zachary for really clarifying the process for redact documents and how we know what is redacted or not. Very important. Again, I am writing on a document that I'm going to show you after we have this initial conversation, tracking these really excellent potential questions that might be asked of the entities during the public hearing. So thank you. This is really, I thought, very thoughtful questions that are being generated. Now, let me see. Jerry, I see your hand up. Please ask your questions.
Thank you, Rhonda. So I'm looking at the healthcare market oversight program, the establishment of it, and the rules, and then that they want us to review the proposed material change transactions to look at A, improving health, increasing quality, reliability, and then also B, achieving health equity and equitable access. And then the stated reasons that you mentioned on slides 45 to 46, I think, it's more financial. And so then I look at some of the questions from question 15, exhibit 1 and 2, and it talks about whether or not they've met their performance measurements and then what they're going to do about equity and access, which is saying what we'd like to do because we're not doing a lot of this now. And so my question is when, as a CRB member looking at the transaction, how do I weigh that? You know, there seems to be a lot of emphasis on the financials, okay? But looking at the rule and what's in statute, it talks more about equity and access and quality of care. And so I'm sitting here saying, it looks like one group is saying, look at the money, look at the finances, make me healthy and whole again. The other part is saying, well, the state and the rules are saying, look at access, equity, and availability, and then is this going to make things better for everyone in the area or in the state? And so that's sort of kind of there's two questions there, but it's like, if you can kind of help me understand sort of how to weight that, to say, Jerry, look at rules and these sections versus don't look at the financial emphasis. So that's it.
Yeah, I love this question, Jerry. Thank you for raising it. I think the legislative intent here, if I can go back to the beginning, because we were tracking this bill as it was just a bill before it was statute, was really looking at designing a system in which transactions are reviewed comprehensively when it is a comprehensive review, to overall make things better in the state. So kind of a holistic view, and that's what the healthcare market oversight program does, kind of look at that holistic view. Finances are a real consideration, as you noted, but overall the criteria still have to be met. And when we analyze the transaction, we do look at it in those four domains: cost, quality, equity, and access, and those are all really important. So although I can't give you weight this one 5% and this other one 32%, and there's not a magic algorithm that I can give you, other than to say I welcome you to look at it holistically and kind of read the materials and ask these good questions. And when it's time for collectively deciding what your recommendation is, be vocal about that. What's on your mind, and what do you think should be kind of risen to the top versus not? I think we welcome that discussion from the CRB.
Thank you, Jerry. Jerry, did you have any other questions that you wanted to ask, or was that your primary one?
No, that was it. Thanks.
Okay. Yeah. And thank you, Zachary, for sharing your perspective on how to move forward through that. Okay, so I just want to, from my notes, it appears that the 7 Community Review Board members who are with us today all had an opportunity to ask up to 3 questions. Just want to make sure I didn't miss anybody in that first round. Okay, now it's about 1:33. I'm going to open it up for that second round, for people to ask other questions, again, about the transaction that would be helpful. We'll stay here probably for, another 5 or 6 minutes, and then we're going to transition over where I'm going to share my screen and kind of, show you the questions that have been tracked, and then really kind of brainstorm more about what are the questions that we want to have on the potential docket to ask at the public hearing. But I see Johanna. Joanna, please go ahead.
So I'm going to go back to the legacy thing, because I think one of the things I'm concerned about is we can't really just assume if we say no and OHA decides no, there's the assumption, I guess, that everything will just continue as it is. But looking at the legacy finances, if that's not so, it's fairly critical that we know that if we say no, all these things that legacy is doing now may be curtailed, because they're going to at some point have to come out even. They can't keep being, I know they were in debt at least, I think they talked about 2 or 3 quarters where they were multi-million in the red. So I think it's important for us to look at a little bit as to what are the consequences if we say yes or if we say no. We're looking at the consequences if we say yes, and are all these things going to happen? But I think we also have to look at the consequences of saying no or recommending no.
Great. Zachary, is there anything that you wanted to comment on that, or?
I think, John, you raised a really good question. I mean, one question that you all could brainstorm and contemplate is, what is Legacy's runway, financial runway, if this proposed transaction doesn't happen, and kind of to hear from the entities themselves to talk a little bit about that.
Great. All right. I see Howard's hand up, please.
Yeah, I guess I want to make sure that we have enough time to do our work in a way that make sure that the public feels that we're legitimate, and whatever our recommendation is, that it's trusted by the public. That's number one. And it feels like 2 hours isn't quite enough to me, and there isn't an infinite amount of time and infinite number of meetings, but I think we just need to keep in mind whether we're getting the amount of time we need to really do the process in a good way that's trusted by the public. And the second question I have is also maybe about this process overall, which is whether our recommendations are just yes or no, or whether we can have yes with some conditions in a yes, related to accountability, for example, ongoing monitoring. There was one interesting letter about the chimpanzee lab, and suggested it's no longer needed, and it's pretty expensive to run and has some other issues. So I was thinking we could have a condition that lab gets closed as part of our recommendation. I'll stop there.
Thank you. Zachary, do you want to talk about, well, there was two questions I heard you raise, Howard. One is just, do we have enough time that we need? So I don't know, Zachary, if you can maybe address that. And then second, of course, is can we give a yes with conditions?
Yep, happy to talk about both of them. So by statute, a community review board can hold up to 2 public hearings. So if you all collectively feel that one is insufficient and you have additional questions that there's not enough time to answer, you can host a second public hearing, and we would obviously help facilitate that and operationalize that. The second point is your ultimate recommendation is, 1 out of 3 choices. And Howard, you said them exactly right. You could recommend approval. You could recommend a rejection or disapproval, or you can recommend approval with conditions. And we would welcome your thoughts about what those conditions may be, or kind of the concerns that you would want the conditions to mitigate, or anything of the above. It doesn't necessarily have to be kind of, here's the exact wording of the condition, but even just thoughts on what those conditions may include would be enormously helpful, if in fact that is the direction you all are going, the approval with conditions. But just to specify, that could be a recommendation. It could be approval with conditions.
Thank you. All right. I see Teresa and Leslie. I'm going to take your 2 questions, and then we're going to transition. I'm going to share my screen so we can really review what we're seeing as potential questions. So go ahead, Teresa, please.
Thanks. I just wanted to piggyback on what Joanna said about what happens if we do not approve this transaction, because I think that's an important point, and point out that the letter from the Oregon Nurses Association in the public comment section endorsed the transaction. And a major part of their reason was that with OHSU, at least we know what we're getting, and it's a local entity rather than the alternative of having some outside private equity firm, for example, come in and acquire the assets of Legacy. So I think they have a point there. Obviously, there are a lot of other issues to be grappled with when we're talking about this, but just wanted to express agreement with that concern.
Thank you, Teresa. Leslie, please.
Thanks, Rhonda. I'm curious to know a little bit more around the payer perspective. There was a comment or maybe a couple comments in the public comments around a recent health insurer carrier going to be out of network effective March 2025 for a large number of individuals in the metro area. And so I'm curious to know how insurance carriers, how it plays into it, and how does that affect the network if they're threatening to, discontinue their contract with OHSU. I'm assuming if this goes forward, that's also for legacy providers, and what does that impact on the numbers in our community? So just a little bit more information about what is their role in this and how does it affect the public. And then the other one is around charity care program design and implementation. I didn't see any numbers included of what both entities are currently providing in the community for people who are in their systems receiving charity care. And the way I understand it is that charity care is separate from the foundation funding. So I would like a little bit more clarity on what are their current numbers for both, and are they planning to match or increase that in the future to meet the needs of community members who don't have insurance or a way to pay for care, especially at these high level trauma, expensive, tertiary, all the different levels of care you explained, Zachary.
Yeah, great points and questions, Leslie. In part of our follow-up, we will send you all links to the Oregon Hospital Community Benefit Dashboard. So we have some published data within the Oregon Health Authority about that community benefit spending, historical, current. You can compare hospitals. I think that'll be really a good resource for everyone. So we'll be sure to send that along.
Great. Well, thank you. I'm just wrapping up the last kind of inquiry that Leslie has, but I would like to now on my slide that I'm going to share in just a moment here. But before I do that, I want to just move us forward on the slide, please, and talk about our next around 15 minutes together. And that is really kind of finishing the brainstorming of potential questions for the public hearing. Next slide, please. Zachary shared this slide earlier. Jerry, I think you were kind of referring, to how do we weigh these criteria, especially on the right side of this slide in terms of costs, access, equity, just improved health outcomes. So it's really important for us to be focusing on that. And so as we're kind of thinking about what are the questions that we might want to ask the entities during the public hearing, these are some really good criteria to keep in mind. What other information do we need to be able to accurately assess these criteria? So just wanted to remind us all to keep those at top of mind. Next slide, please. So let me just lay out a proposal process for us moving forward. Today, we will leave this meeting with a brainstorm of potential inquiries, potential questions that we can ask the entities. At the next meeting, we will refine as a community review board, what is a prioritized list of questions? Like what are the most important questions that we would want Oregon Health Authority to ask the entities at the public hearing? I want to be clear that before the public hearing, Oregon Health Authority will finalize the list of questions they have kind of the final say in what questions will be asked. So that is our process for developing the questions. I also heard Zachary reminding us in response to Howard's question that after this first hearing, if we feel that there's more questions and more time, there is an opportunity to host a second public hearing as well. Zachary, did you want to add anything else to the next step for the public hearing beyond what I've just shared?
No, I think that covers it.
Okay, so next slide, please. Oh no, wait, sorry. Now I'm going to share my screen. All right, I'm hoping, do people see a Word document here?
Yep.
Okay, what I'd like to do is just go through what I was hearing about some areas of inquiry. I don't want to wordsmith. This is not about wordsmithing the words and writing a specific question. This is more about just getting the ideas of things that we might want to ask during the public hearing. So what I heard is some of us were interested in why Legacy is pivoting to agree to this acquisition. We had a lot of concerns like, what if there's a no? What is Legacy's longer financial situation? What is Legacy's financial runway? What happens? What are the consequences if this proposed transaction doesn't move forward? If OHA disapproves. We're curious, why is Legacy not utilizing its full capacity? What is the situation for Legacy Nurses Union? We heard that we believe OHSU personnel is covered. We just weren't sure about the Legacy side. How specifically will the proposed transaction increase access to care? How will LifeFlight Network, especially costs, change perhaps when now 50% of the ownership is in Metro? How will OHSU recruit more healthcare providers to improve access to care if the transaction goes forward, given that typically we need more providers in order to provide more access? Some of us were concerned, there has been some current concerns about OHSU's financial and leadership instability or challenges. And so we're curious, how will OHSU be capable of taking on this additional $1 billion in debt and integration of this whole new enterprise, right? There was some questions that we had about that. With the new federal administration and NIH, I think indirect costs being capped, there is a concern of how that will affect OHSU's financial stability since they bring in, I don't know, there are millions, I know there was on a slide, but millions and millions of dollars in probably federal research dollars. And how will OHSU meet quality metrics that are not currently met with the acquisition? What will be the process for doing that? And then I was just finishing the last questions that I've heard. I think, Leslie, this was more about you, is how will the proposed transaction affect payers, health insurance, especially in network? Was one thing. And then the other was, how will proposed transaction affect charity care? Or what is it? I think it will affect charity care. And those are providing care to uninsured or underinsured people. I guess you also were curious is what is the current amount of resources allocated and how will the proposed transaction affect charity care? So these are the kind of concepts that I heard during this conversation. So please, Teresa, kick us off. Are there any modifications to what I was hearing, and are there additional ones that we want to make sure that we have on this brainstorming list?
Just a small one, where it says, what is situation for Legacy Nurses Union?
Yeah.
I think that's for all Legacy staff because there are many different unions.
Okay. What I'm going to say, what is the
Legacy employees.
Legacy employees, particularly for Legacy employees unions? What is that the correct unions? Okay, thank you. Teresa, do you have another comment or question? Okay, Howard, please.
I wonder about all the providers and how they will be supported so we don't lose providers when there's an acquisition like this, particularly maybe on the Legacy side, but perhaps on both sides.
So how will providers be supported moving forward?
Yeah. And there are differences in the benefits in Legacy and OHSU. For example, the Legacy provider faculty may have different retirement plans than the Legacy providers.
Then the OHSU, you said, so Legacy provider faculty may have different retirement than OHSU?
Well, yeah, OHSU than Legacy, but it can be Legacy than OHSU, that's fine.
Uh-huh.
I mean, academic faculty oftentimes have very lucrative retirement plans in terms of how their retirement works, and then probably the Legacy providers.
Okay, great. Others, I see Wendy, your hand's raised, please.
Yeah, So it's a little different than looking specifically at a healthcare merger, but with any merger, how are they going to gauge success? What are the key metrics they're going to be looking at over time? What systems are they going to put into place to sort of govern themselves on this? They're saying what they're aiming for. How are they going to know if they get there? And what if they don't?
Thank you. Great.
Rhonda, can I jump in just real
Please,
quick?
Joe. Yes.
This is Zachary. Just so that reminded me, the entities have submitted some materials, and we can highlight them for you in our follow-up email about the specific quality metrics, some equity metrics that they have thus far developed. I don't know if that exactly answers the question that you raised, Wendy, but it's related, and so we'll be sure to highlight some of that for you.
Thank you, Zachary. That would be wonderful. Wendy, did you have another comment or modification? Nope. Okay. Joe, I see your hand.
Thank you. Yeah, this is Joe Schnabel. I just have a possible, not trying to wordsmith, but what is the situation for legacy employee unions? I think maybe, are we trying to get at what are the commitments to both OHSU and legacy employees post acquisition, if it were to be approved? To maybe have those spelled out very clearly that kind of encompasses all levels of employees, whether they're union represented or not. I think that would be helpful. And then I did have one other kind of minor question. I noted that the Legacy Board does have some religious affiliation with it, and I know Legacy's affiliations with religious entities has changed over the years. I'm not really sure what they are, but post acquisition, I mean, they would become kind of a state entity, and I don't know what that would mean for kind of the religious connections that have existed with Legacy, and whether those would have to be severed or whether they could continue forward with those, or just how that would work.
Great. Okay. Thank you. All right. Joe, anything else to add? All right.
Nothing.
We have
Thanks.
probably just about 3 more minutes. So I'm just letting folks know we were coming to a wrap up. Teresa, please. Oh, you're on mute. Yep.
That was an accident, but I actually do have something to add.
Okay.
And that is, sorry. I think the question about quality metrics and some of the questions about the goals of the transaction, I understand that they put together measurable outcomes. They have said that there are outcomes they're trying to achieve. But the place that I did not see in reading these documents is how do they get there? What does the implementation look like? And that's really the meat of the matter. A lot of it, they said, well, it all has to be worked out once it's all done. And to me, that is not satisfactory. I would like to know more about how they're going to achieve these lofty goals.
Mm-hmm. Great. Thank you. Howard.
I just want to bring up there are independent provider groups and providers in the community that may be impacted by this merger. And there were some of the public comments had to do with that. And how there just needs to be things in place to protect them in terms of competition, how they're going to do that.
Great, thank you. I want to pause for a second. According to my tracking over this part of the session, pretty much everyone has had an opportunity to share an additional potential question or clarification. I just want to open up to Johanna. Joanna, I don't know if there's anything that you want to be able to offer.
I think the question about the legacy inability, not using all their facilities.
Mm-hmm.
I think there was something somewhere that I read that they were just having a really big challenge in hiring medical professionals. And so that was part of why they're not being used, but I'm not sure if that's correct, but it would be useful to find out. Again, what's going to happen if they don't merge or be acquired, what happens to all that excess capacity?
Mm-hmm. Great, thank you. Okay, Howard, one last question, and then we're going to move to close.
Oh, that's just me forgetting to put my hand down.
Okay, wonderful. Okay, well, we've got a great brainstorm list here. Covered a lot of ground, a lot of potential great questions here. So again, OHA staff will be looking at this. The next meeting will really be a second dive, as well as the second dive into consequences, as well as a refinement of this list. I'm going to stop sharing now. And Melissa, can we go back to the last, to the next slide? I think slide. Okay, so in terms of the next meeting, we will be meeting on February 24th next week from 11 to 1. As I've shared, the agenda will focus more on the proposed transaction, providing additional details, giving more summary about entity statements, about exit access, equity, quality, and cost. Again, those are the criteria, right, that we'll really be using to help make the recommendation. So getting really clear about that. Look at some of OHA's analyses that they've done regarding some of these criteria. And then, of course, we'll continue to discuss and then revise the public hearing questions that then we can sign off to OHA to vet and to be the asker of questions during the public hearing. There'll be materials for you to be reviewing, exhibits from the notice and any materials from previous meetings that you have not reviewed yet, including new public comments. I know Zachary is saying, they just got some more public comments today. Also, Zachary highlighted several times during our conversation, based on your questions, being able to send out specific areas to look in the documents for some of the questions that you raised. So I know Lauren in her follow-up email we'll list those and we'll provide to be more specific about where to find the information. Joanna, please.
I just had a real quick question. For the new public comments, are they getting added to the bottom of the list or do they get added at the top?
Great question. So they're added to the bottom of the list.
Okay.
And it's often in two places to make it as easy as possible. At the top, there's kind of all the comments combined. And what happens, sometimes we get a quick email comment, sometimes we get a full 15-page document. And so when it's the latter, when it's a full document, we post that whole document and link to that document in the kind of consolidated, aggregated version at the top. So easiest thing to do is just look at the bottom because that's going to be the most recent stuff.
Thank you.
Thank you for that question, Joanna. Zachary, were you going to add anything else for the next meeting?
No, I think we covered it all.
Okay, can we go to the next slide, please? So the next meeting, of course, on the OHA's website, the Zoom link will be available there. Again, this is the email for our public citizens who want to provide comments, questions. Please use the email and also go onto the website. There is a form to fill out for public comments. Next slide, please. And again, a big thank you, a big thank you to our Community Review Board members for spending the time in reviewing public comments and reviewing the documents, is coming fully focused on our task at hand during these 2 hours together. Thank you for asking very important and insightful questions for us to get more clarity about the transaction, as well as what might be some very important questions to ask the entities so we can get a sense about the criteria that we're going to have to weigh around cost, quality, access, and equity. I hope that we accomplished what we set out today, and that was to gain a greater understanding of the proposed transaction and to document this initial list that's going to be great ground for us to finalize. I look forward to the next meeting next week. And I wish you all the best for the rest of your day. Take care. Bye-bye.